Org. Rosano. Here. Simpson.
Here.
Cleary.
Here.
Epicora.
Yay.
Andrew Joyce.
Here.
Miller.
Present.
Stein. Lockhart.
Here.
And Moriello.
Here.
You have a quorum.
First order of business is approving the minutes from the previous meeting. Motion, second. All in favor?
Aye.
Opposed?
Item 2 is authorizing acceptance of appropriations from the New York State Office of Temporary and Disability Assistance regarding temporary assistance for needy families funding and amending the 2025 Department of Social Services budget.
Good evening and happy fall,
Morning.
first day of fall. Yes, the Department of Social Services is asking for the authorization to add appropriation for the 25-26 budget of $496,153,000 for us to implement a family-centered case management program. This program, we had an allocation last year. We've built the infrastructure to bring on the team. This year we plan on bringing on the caseworkers to actually work with our families to help them get better stabilized in the community. And our target population will be those with mental illness, substance abuse disorders, developmental disabilities, our homeless population, and DV situations. The services that will fall under this program will be assessment of the family's needs and identification of barriers that can help them remain stable and housed in the community. So we're asking for approval to add the appropriation of $496,153 into our budget for the 25-26 fiscal year.
Are there any questions?
Make a motion to approve.
Second?
No
questions?
Yes, I have just a quick question. How many families do you serve, or have you been serving?
I don't have the exact number. I know that, one of our target populations will be the homeless families. So we currently have 60 homeless families currently in one of our shelters and another 19 in one of our other shelters. So about 80 families currently that we would focus our efforts on to try to get them stably housed and get them the services that they need to remain stable.
And when you say stably housed, where would that be?
It depends on the situation. So, we would be looking to work with them to figure out if there are apartments and other housing available for them that they can
This is all
afford.
subsidized housing for,
Part of it will be subsidized. We have some programs that we try to work with through a rental supplement program, and we're waiting for state approval to get another program in place to help subsidize some of the costs of rentals for some of these individuals.
do you know how successful the program has been?
For the family center case
Yes.
management, so we haven't implemented yet. So we're in the process of implementing. So we just started, we have the team starting in the next 2 weeks. So we hope to have some data and some success to share with you probably by the end of the year, beginning of next.
Okay. Thank you.
Are these caseworkers that have already been in the employ of your department, or are they new people coming in?
No, these are new individuals coming in the door.
We have, in a second? Oh, do you have a question?
Question.
Oh,
Just a follow-up. Haven't we been providing any of this already to, the temporary and disability assistance people?
So most of our staff in our temporary assistance division are eligibility examiners, so they determine eligibility.
So it's just about eligibility?
That's correct. So,
Okay.
They will provide assistance where they can, but that's not their focus
Okay.
and that's not their role. So
I
the
understand.
role is to provide more targeted case management for these families so we can
Mm.
provide more support and assistance.
Okay, good.
Do we have a second?
I'll have a second.
All those in favor?
Aye.
Opposed?
Thank you.
Thank you, Commissioner.
Item 3 is authorizing the renewal of an agreement with St. Catherine's Center for Children regarding specialty prevention services for the Parent Care Program. Commissioner Manning is here this evening.
Good evening, everyone. Yes, this is the St. Catherine's Parent Care Program, and again, it's a prevention program, and we're preventing children from entering foster care, either due to abuse and neglect or juvenile justice involvement. So St. Catherine's has a unique program because they're focused on parents with either developmental disabilities or mental health challenges. So they really work with the families on education, vocational skills, life skills, and they work with any child of the age spectrum. And they will serve 43 families this year, and they've also added a family resource center that is available or parents, either to get their basic needs met, but also a place where they can get support from staff during the day. Again, the goal of preventive services is to reduce the risk of foster care, but also enhance the parent-child relationship to ensure that child is safe in the community.
Thank you. Again, any idea on the success rate of the program?
They actually provide us stats on a monthly basis. All of our prevention programs do, and you could see that, again, we're avoiding placement or further involvement, for example, in the juvenile justice system.
Okay.
So if you'd like that, I can get that
Sure,
information.
that'd be great. Thank you. Thank you.
Are there any other questions?
Motion?
Second? All in favor?
Aye.
Opposed?
Item 4 is authorizing renewal of an agreement with Parsons Child and Family Center regarding the provision of clinical prevention services with community and recreational supports.
Thank you. Yes, again, they're working with families that are at high risk of foster care placement or juvenile justice involvement. And this past year, Parsons 2 has developed a family resource center that just had the ribbon cutting 2 months ago. It really is beneficial. There's a lot of activities for the children to take part in. They actually are doing trades such as a barbershop, music, videos. So it's really a real benefit. In addition, they also have the PATH program, which is kind of like an after-school program for youth, especially the ones that are involved in the juvenile justice system, to get them off the streets and give them some structured environment. And they serve 75 families.
How do you identify these children or the families that need these services?
We actually have a weekly prevention coalition meeting, and basically the referrals can come from our child protective workers, our mental health staff. They can also come from probation, and there can also be self-referrals. Families can call up and say, I need services and supports. So really, school districts, we're open to anyone, and it's reviewed by the committee, and we make the fit of what would be an appropriate preventive service.
Okay, thank you.
These are similar, the prevention programs, and even the next one, I believe, and they all have different amount of number of families that they can serve. When they apply for this money to us, right? They do it based on slots that they can have?
Correct.
Yeah, so,
Correct.
is it because Trinity, Parsons, I'll say, is bigger than St. Catherine's in terms of being able to provide services?
Correct.
They have to show you that we're able to provide services for 75 families.
Right, they have the clinical
Do we have a total
staff.
number of slots for those prevention programs
I-
that we're looking at to give out, so to speak, give out?
Well, we have to set a lot of money, and then
Okay.
that's what we break it down. And depending on their costs as well,
Mhm.
is also dependent on how many slots, if you will, they will
Right.
have. St. Catherine's is a much more of an intensive program, so they're out there multiple times a week and identifying what that parent needs in order to maintain the household and keep the children safe.
Okay.
So-
It also depends on the services, and they're not totally competing against each other for slots, right?
No,
Because they're all offering a little bit different?
something different,
Okay.
correct.
Okay.
And having a specialty, like St. Catherine's is developmental disabilities and serious emotional disturbance, or parents with mental health issues.
Okay.
So Parsons is one of our strongest clinical.
Mhm.
I would say Parsons and Trinity are our strongest clinical, and they have the staffing patterns that can help support the number of slots that they have.
Yeah. Thank you for the
Mhm.
little bit more in depth, thanks.
Any other questions? Have a motion? Second?
Second.
All those in favor?
Aye.
Opposed? Motion passes.
Item 5 is authorizing renewal of an agreement with Trinity Alliance of the Capital Region regarding the provision of clinical prevention services with community and recreational supports.
Thank you. Yes, Trinity's been in the business for quite many years, and they actually have 95 slots allotted to them. And one thing that they did bring in this year is an evening reporting youth engagement specialist. That specialist will work individually with the youth that are identified through the preventive services and really help enhance their skills. You know, if it's going to be vocational, educational, help support and mentor those juveniles in the community. And, you know, they really work with youth ages 13 to 18 with the youth engagement specialist. And they're also available on the weekends, which is really key because that's when youth typically get into some trouble is evenings and weekends.
Do children age out of this? I mean, like 18 seems to be the age when people are considered adults. Someone with developmental disabilities, when they reach 18, are they out of these programs or are they?
They don't have to be, especially if they're still in school, that we can really, like even youth in foster care, they can be in our care until 21. And so we do transitional services for them to ensure their needs are being met. And that would include, if it was a developmental disability, bridging with OPWDD, or if it's a mental health issue, you know, bridging to an adult service.
Thank you. Any other questions? Can I have a motion? Second? All in favor? Opposed?
Item 6 is authorizing renewal of an agreement with Together for Youth regarding the Home Run Program.
Thank you. Yes, another preventive service program, you know, again, avoiding youth getting involved in probation and the juvenile justice system. The Home Run Program is a truancy prevention program that we want youth to be attending school on a regular basis. So they actually are providing services in Cohoes as well as in the city of Albany, and really looking at the detention numbers because we don't want a youth to be truant so much that it ends up being a child protective issue and that the parent isn't following through with getting them to school. So this program helps support the parent, find out what the root cause is for the child not attending school.
Any questions? Motion? Oh, questions.
Question. So there's been a lot of discussion over the past year about the county's role in public safety, and truancy is an issue that's come up pretty often. I hear it from contacts in family court, and the county's role is multifaceted in addressing that specific issue. It starts with the school district, I believe, but hopefully there's good crosstalk and coordination between the county and the school district. A couple questions on it. Number one, Albany and Cohoes, is that where the truancy issue is more prevalent in the county? Or?
Yes, and they were also in Waterville. However, basically we're asking for space in these schools, and they couldn't accommodate the space for Together for Youth. So we offer it. I should also note that last week we met with the Cohoes School District specifically regarding truancy and what services and supports we could provide the school in addition to Home Run. This week we have a meeting with Albany City, and we also have one with Rabina Queen and Selkirk. So we are, you know, we do have the dialogue and want to hear from the districts about how the county can assist them.
Right. It's encouraging to see that on the agenda. So we mentioned Albany and Waterville. Can you just talk a little bit, you don't have to go into the whole process, but what your department does to address truancy in Albany County?
Well, I think, you know, we're also revisiting a program that used to be in the works in Albany City, the truancy abatement program. So we're really looking at that again as a possible option for the districts and to be there as a support.
Let us know how we can help.
Thank
Gladly
you.
support it. Can you add me as a sponsor of this, please? Make a motion, too. There's no other motions.
Second?
Second X be added as well, please.
All in favor? Opposed?
Item 7 is authorizing renewal of an agreement with Cayuga Centers regarding the provision of clinical prevention services for the Family Support Program.
Yes, the Family Support Program is, again, serving children 0 to 18, but typically they're about 10 to 17. It's that transition age youth that oftentimes needs a lot of support. But however, we can serve youth up to 21. And again, the children are at risk of removal, and that could be due to abuse, neglect, trauma, or juvenile justice involvement. And this is like an intensive family service support program. So the clinical people, meaning the social workers, go out 2 to 3 times a week to identify what the needs are. So it is an intensive program, and typically about a 6-month to a 9-month program.
Questions? Motion? Second? All in favor? Opposed? I have a motion to adjourn the meeting.
There's Coyote Center.
They are off Central Avenue.
Thank you.
Did they change their name from something else?
No,
Aye.
Berkshire Farms did. Tight.
Oh, that's what I'm thinking.
Together. Mhm.
Yeah,
Aye.
thank you.
That last one, I was gonna, if you went too quickly. Is that, yeah, just in Save Albany too, the Cayuga one, is that?
Oh, no,
whoever?
no, no, it's
whoever
all
you-
about it.
Okay.
Yep.